Should you treat subclinical hypothyroidism? Subclinical hypothyroidism is a condition where thyroid-stimulating hormone levels are elevated, but free thyroxine levels remain normal. This often occurs without noticeable symptoms. Deciding whether to treat subclinical hypothyroidism is not straightforward and depends on several factors. First, let's talk about thyroid-stimulating hormone levels. If your TSH level is greater than 10 milli-international units per liter, treatment is usually recommended. This is particularly true for individuals aged 70 or younger who do not have cardiovascular disease. For TSH levels that fall between the upper limit of normal and 10 milli-international units per liter, treatment decisions become more personalized and should take into account individual circumstances. Next, consider whether you have any symptoms of hypothyroidism. If you do experience symptoms, starting treatment with levothyroxine may be beneficial, even if your TSH is below 10 milli-international units per liter. Age is another important factor. Younger patients often see more benefits from treatment. In contrast, older adults, especially those over 70, may find that mild elevations in TSH levels can normalize on their own. For these individuals, a watch and wait approach is often preferred to avoid unnecessary treatment. Thyroid peroxidase antibodies are another consideration. If you test positive for these antibodies, you may have a higher risk of developing overt hypothyroidism. This could justify starting treatment or at least closer monitoring of your thyroid function. Pregnancy and fertility also play a crucial role in treatment decisions. For women who are pregnant or planning to become pregnant, treatment is generally recommended if TSH levels exceed 2.5 milli-international units per liter, especially if they also have positive thyroid antibodies. This is important due to potential risks such as miscarriage and developmental issues for the baby. Lastly, if you have cardiovascular disease or risk factors, it's essential to approach treatment cautiously. Starting with low doses of levothyroxine can help avoid complications related to the heart. Monitoring is key. Many people with subclinical hypothyroidism may see their TSH levels return to normal over time. Therefore, it is important to repeat TSH testing after 2 to 3 months before starting any therapy. In summary, the decision to treat subclinical hypothyroidism should be tailored to each individual. Levothyroxine therapy is clearly indicated for those with TSH levels greater than 10 milli-international units per liter, symptomatic individuals, pregnant women, and those with positive thyroid antibodies. For others, particularly older adults with mild TSH elevation, careful observation and periodic testing may be the best approach. Always consult with a healthcare professional to consider your specific situation and ensure the best possible outcomes.